Good afternoon, everyone. Thanks for tuning in to watch our Facebook Live session today. I'm Shamin from GetDoc, and this is Dr. Helena from KL Fertility Center. So our session today is brought to you by KL Fertility Center and supported by GetDoc. So before we start our session, would you like to introduce yourself, Dr. Helena?
Thank you very much. I'm Dr. Helena Lim. I'm one of the consultant obstetrician and gynecologists and a fertility specialist at KL Fertility Center. Thank you very much for your interview today.
So thanks for your introduction, Dr. Helena.
Yep.
So our topic today is busting the myth on surrogacy. So just a gentle reminder to you guys that should you have any questions throughout the session, feel free to drop your question in the comment box below so that Dr. Helena can get your questions covered. So we know that because of a lot of infertility issues,
yes,
there are a lot of misconceptions about surrogacy and all, right?
Yes,
so,
that's right.
Let's start our session today to dive into the topic.
Yes, okay.
Yeah, so first of all, Dr. Helena, so what is surrogacy and how does surrogacy work actually?
Okay, surrogacy actually means that you are commissioning parents, meaning that a couple who actually produce their egg and a sperm and fertilize them and create embryo. But instead of putting the embryo back into the wife's womb, they are actually putting the embryos into another woman's womb. Okay, so the woman is actually carrying the baby instead of the wife. Okay, so it's like borrowing somebody's uterus.
Yeah.
Yes. Okay, so that is what we call gestational surrogacy. Now there are two types of surrogacy. Old type of surrogacy is what we call a traditional surrogacy. Now the traditional surrogacy involve using the husband's sperm to inseminate the surrogate mother, meaning that the egg comes from the surrogate mother, and the surrogate mother carries the pregnancy up to term, deliver the baby, and hands the baby to the commissioning parents. Okay, so meaning that the baby produced for this traditional surrogacy was actually carrying half of the chromosome from the commissioning father. But there's actually no chromosome from the commissioning mother, so only half genetically related to them. Now, in a gestation surrogacy, that will involve an IVF. Now, what happened is that the commissioning parent, meaning the husband and wife, produced an egg and a sperm and created an embryo. And after which the embryo is placed into a surrogate mother to carry out the pregnancy. And after the baby is delivered, the baby is being handed back to the commissioning parent, and genetic-wise, the babies are actually genetic related to both the father and the mother. Okay.
I see.
All right.
So how much is the cost if the couple decide to go for surrogacy?
Okay, now I have to stress here that surrogacy is actually illegal in many parts of the world. Now, we are going to talk about why is it illegal, and we are going to talk about the complication and so forth. But there are actually some countries that allows altruistic surrogacy, meaning that they will allow people to help to become a surrogate mother, but without being paid. Okay, so commercial surrogacy actually is across the board mainly illegal in many parts of this world. Okay, now why did that surrogacy is actually exist in this world? Now, it all has to go back to very interesting history, as well as if you look at things in the Bible, if you look back even a few thousand years ago. Now what happens is that if you look at Abraham and Sarah, okay, in the Old Testament, so Sarah could not give birth because she was way past the age of being able to conceive. So what did Sarah do is actually get her servant maid to have a child with Abraham. So that is what we call a traditional surrogate. Okay. Now that actually existed in the olden times. Now, what happens when you translate in the modern time? Why did surrogate still happen? Now, there are still surrogacy in ways of traditional surrogacy. It may be due to, for example, the wife is actually doesn't have ovaries or doesn't have uterus and so forth. Now, again, but it has now become as things have changed with the advent of IVF and so forth. So surrogacy become more and more complex in that manner, because nowadays you can actually do IVF to create embryos. Okay. Yep. Now the thing is, who will need a surrogacy? Now, for example, if the couple, the wife actually doesn't have a uterus due to congenital, for example, the wife is born without a uterus but have ovaries, for example, then she can still produce eggs. Now, or the wife have issues in the uterus, and the uterus needs to be removed. For example, if the wife had cancer of the uterus and the uterus needs to be removed. Or in some cases whereby the wife have issues for pregnancy, for example, they have very medical complications, for example, very high blood pressure, for example, very bad diabetes, for example, or a heart issue, whereby carrying a baby in the uterus or pregnancy actually poses a risk for them. So these are the people that need a surrogacy. Now, surrogacy, well, when you observe what is happening now across the board worldwide, why is it that although surrogacy is actually illegal, but why does people risk, having, surrogacy and do things illegally and trying to get surrogacy? Well, the issues now is that there are a lot of, especially in Asia, a lot of people believe that if you cannot get pregnant, if you do IVF and you put back the embryos and you don't get pregnant, it's because your uterus is bad. Okay, a lot of us, believe that, especially they go to Sikh traditional medicine, and then the traditional healer would tell them that your uterus is too cold, or for example, your body is too cold, and therefore you couldn't get pregnant. So a lot of people have this misunderstanding, thinking that the reason why people don't get pregnant is because of a uterus problem. Actually, in actual fact, nowadays with a lot of work in, for example, PGS, pre-implantation genetic screening test, whereby we do a lot of biopsy and testing the embryos, now we realize if you do an IVF and you couldn't get pregnant with the embryos that you created, 70 to 80% of the time is because the embryos is abnormal. 20 to 30% is actually due to other factors. For example, uterus environment, or you have deficiency in vitamin D, for example, or you have natural killer cell overactivity, or for example, if your blood flow is not great. And these are the things which are correctable. So in fact, the need of surrogacy now, after all these years, that we realize that the need of surrogacy is actually very, very little.
Yes. So given that all of these alternatives that are available to surrogacy, if there are still people who still want to go for surrogacy, but there are also risks if you insist to go for surrogacy even though it's illegal, right?
That's right, yeah.
So if someone wants to go for surrogacy, is there any cases where the surrogate mother refused to release the baby?
Yes, actually, absolutely. That is what the very, very high landmark case in America, whereby the commissioning parents actually sign a legal document with the surrogate mother, and then the surrogate mother actually agreed to carry the pregnancy. And upon delivery of the child, she refused to give back the child to the commissioning parents, because she has developed this sense of bonding with the baby.
Psychologically.
Yes, that's right. So in fact, that is one of the issues why you see surrogacy is becoming so complex, and therefore why in many countries surrogacy is actually being banned. Or is actually deemed illegal, and because there are a lot of ethical, a lot of law related problems, as well as psychological problems, and of course the citizenship again is also another problem when it comes to the child being born. Now, according to most of the law in worldwide, and especially our common law, now, if the baby delivered from a uterus of a mother, the baby belongs to the mother. So can you imagine if you actually put back your embryos into another woman's uterus, and when the baby is born, legally the baby belongs to that mother, the surrogate mother. So that actually complicates a lot of issues in the whole process, the whole issues. Okay, so therefore, it is actually very, until now, I think we still have not have a very clear guideline or, a solution to this problem.
Okay, so which means that even if you insist to go for surrogacy, even if you have a surrogacy contract, it may not be enforceable.
Absolutely, yeah.
And it could be like your child is belongs to the surrogate mother.
Correct, yeah.
So there was a surrogacy case in Australia and Thailand where the surrogate mother gave birth to a twins, and one of them called baby Gammy.
Correct.
It's a baby with a Down syndrome.
Yeah.
But complications then arose because of the claim of rights over the children, right?
Yes, that's right.
Is there any other potential issues that both intended parents and the surrogate mother will face in this scenario?
Well, the thing is, let me just can I just tell you a little bit more about this case, because this is actually again a very landmark case and a very. What happened in Australia is that in Thailand is that these commissioning parents actually went to Thailand and found a surrogate mother. And then they did an IVF, put back the embryos into the surrogate mother, and one of the baby turned out to be a Down syndrome baby. Now, when the twin babies were born, so the Australian couple took back the normal baby and left the Down syndrome baby with the surrogate mother. Now, that actually creates a big outcry in worldwide, especially in Australia and Thailand as well. And because of this case, now Thailand now bans surrogacy. They amended the law to ban surrogacy because of this landmark case. So I think that the Thai government is actually doing a good job, because that clamps down, this kind of illegal transaction. That also clamps down, things like that from happening. But we also need to ask ourselves, is there any place at all that we should consider, altruistic surrogacy? Now, according to some of the experts in Thailand, altruistic surrogacy is allowed if they are actually a relative. For example, if I don't have a uterus and I have an issue, for example, medical disorder, and I cannot carry out a pregnancy, and if you are my younger sister or my older sister or my cousin, which is the same same generation, then you can become a altruistic surrogate for me. However, this has to go through a committee, which there's a legal binding committee to actually approve the case or not. So the government becomes involved in this kind of arrangement.
But still, the risk of surrogacy will still be there, like after they give birth to the child.
Yeah, there are still, medical complications, for example. Okay, then there are things that we still have to consider. For example, if you're my younger sister and you agreed to become my surrogate mother, and you carry the pregnancy, and let's say you have a complication during the pregnancy, for example, and then, for example, you have a postpartum hemorrhage. You bleed, you were bleeding very heavily, and after which you need to remove your uterus to save your life after the delivery. But when you are if you are single, okay, that may not have a great issue. But if you are already in a marital relationship, what will your husband feel? What will your husband say? You see, these are very sensitive things that we can never be able to tease out with just having a good law. Yeah, so a lot of family complications, relationship complication arise, and psychological, psychosocial complication arise from surrogacy.
So it's a very, very big issue in a society that
absolutely.
People should be aware of it.
Correct, yeah, and especially in an Asian setting. Yeah.
So may I know, in terms of the surrogacy, so what is the motivation behind women who are willing to be surrogates? And are they exploited just because they need to earn their living?
Very sadly, sometimes what we know that commercial surrogacy are driven by the poverty, for example, and also the need to get money. So again, these are very sensitive areas. For example, I have personally came across women who are really willing to help other women by being an altruistic surrogate. So many years ago, I met a lady in the UK, whereby she actually became a surrogate mother for her good friend, because her good friend had heart disease and cannot carry the pregnancy, and that went on very well. Now, But we know that many parts of the world, surrogacy, commercial surrogacy, is actually driven by poverty. For example, in India, commercial surrogacy was once upon a time allowed under the law. So what we know that there are women who have come from very, very poor background, who came into the so-called surrogate farm or surrogate village and to become surrogate mother. And after being given birth, they go back to their village, and what they earn. These are all rumors. I really have no data to support what I'm saying. But the thing is, what they are earning actually equals to, by being a surrogate mother, equals to the earning for her whole household for the next 10 years. So these are, driven by, poverty. And are they being exploited? The answer is yes, because we know that the amount being paid to these women are usually very little compared to what the commissioning parents paid to the agency. So that actually poses a moral issue for doctors like us, whether you should or should not support commercial surrogacy in this way. So there's a lot of ethical challenge here. So again, I hate to equate this to prostitution, but it is also very hard for us to decide, because like prostitution and surrogacy, you're using your money in your body to exchange for something. Yes. So is this something equivalent to prostitution? So again, for us doctors, moral police and a moral judge in that way. But every day when we have to do all these things, we have to ask ourselves what we are doing, is it morally right or not? And that's actually poses a great challenge in the field of IVF.
Yeah, and also will it pose harm to,
absolutely,
because there will be health risks and all, right?
Correct. And a lot of times this commercial surrogate mothers, they may have been pregnant, they have 5 children at home or 6 children at home, for example, and they are here carrying another baby, and they are really a very high, what we call high parity women, and they have a higher risk of malnutrition, for example. They have higher risk of postpartum hemorrhage and other medical disorder associated with pregnancy. So again, are we putting them at risk or not? And I think these are the things that one has to really thread carefully.
Yes, so really have to think about it before you make any decision. So what kind of treatments that a surrogate mother has to undergo before carrying a child, and is there any associated health risk with that?
Well, the thing is, usually what happens is a surrogate mother, well, I can't say for sure because you see, we in Malaysia it's illegal and none of us actually do surrogacy. But the thing is, to become a surrogate mother, there are actually conditions. For example, they should actually be healthy, they should be able to carry out the pregnancy and so forth. But the truth is, when they are desperate for money, they can, a lot of them will just go through the surrogacy process, regardless of the risk that they have to face. They may not even be suitable to become a surrogate mother, but they still carry on. And agencies who are, being the agents who are responsible for these surrogacy activities and so forth, again, a lot of times they are actually driven by, earning money. Mm-hmm. So a lot of times they put these women through, surrogacy without even properly, select, who are the, who are appropriate people. The thing is, are they concerned about the well-being of the surrogate mother? Nobody knows.
Yeah, so it's like sort of like an unknown issue that happens without us seeing and
correct,
being aware of it.
Yes, because again, there's actually, because it's illegal, and now it's actually becoming, it's very easy. These activities are all underground.
Yeah. So given that all of these health risks that the surrogate mother will potentially have by getting involved in this surrogacy, so will there be any risk that the surrogacy fail after everything is being paid for?
Absolutely. As we know that, as we just mentioned, the pre-implantation, well, because of the work in pre-implantation genetic screening, now we know that, a lot of failed implantation, a lot of miscarriages are due to chromosome abnormalities. Okay, not due to the uterus environment. So you can imagine if you actually have do an IVF, produce an embryo and put back in other women's uterus. If the embryo is bad itself in terms of chromosome, we know that it won't get implanted, even though it goes to another woman's uterus, for example. Miscarriages can still happen.
Okay. So it's sort of like beyond our control already.
Absolutely.
Right?
So now with more understanding about IVF, more understanding about our embryos, our chromosome makeup and so forth, now I can see that the need for surrogacy, or the myth thinking that you need a surrogacy, has actually become less and less, because now we all know that most of the time is due to the embryos rather than the uterus environment.
Yeah. So what are the alternatives that the couples could go for instead of surrogacy?
Well, why is it that we have to ask ourselves, why is that they have this misconception that they need a surrogacy? Now, most people will not. I would say that, if you give, a few millions of people, probably 1 or 2 need surrogacy due to, for example, the reason that we mentioned just now. Now, the thing is, if IVF doesn't work out, we need to ask ourselves why it didn't work out. Is it that because you keep producing embryos which are bad? So screening test becomes a very important tool, for example, to screen the embryos and to see that whether the embryos are all bad and all that. Okay, and there are things that you need to do to improve your personal health. For example, your uterus, your ovarian function, for example, or your egg quality, for example, or sperm quality, for example.
Which could be linked to the lifestyle of a person, right?
Absolutely. So nowadays, I'm glad that a lot of this genetic works is now becoming more and more. The evidence about this genetic works has become more and more apparent. So I'm very glad that takes away the the misconception that you really need a surrogate mother in order to have a successful outcome.
Yeah, so most importantly, find out the factor of infertility before making any decision.
Absolutely.
Like especially surrogacy, we know that there's a lot of ethical complications.
Absolutely.
All right. Yeah. So
I also wanted to highlight that some people feel that surrogacy has become a very convenient thing. For example, I'm a very high-ranking I'm very busy with my business or my career and so forth, and I don't have time to carry a baby. So you find a surrogate mother and all that. Well, we also need to talk about. In fact, there's a lot of science about epigenetics. For example, your uterus environment and the bonding of your baby with you actually determines the genetic expression of what happens to your baby next time. Okay. So can you imagine that you put the embryos into a surrogate mother? If the surrogate mother drinks and smokes and take drugs and so forth, well, that creates you wouldn't know, and that creates issues with your offsprings as well.
Yes, and most importantly, it's like the bond that you have with the kid.
Yeah, and I think that we still have to go back to nature, meaning that by nature we are created to carry our babies.
Yeah.
Pregnancy is something very special. It's a very special time for the mother to bond with the baby. Yeah. And if you lose that link, I think that is actually very, very regrettable.
Like no matter how much you pay for it, you can't gain back the bond with the baby.
You can't. So these are the very special things that I would like women to be aware of. Yeah.
So thank you, Dr. Helena, for this informative session. I believe that our viewers have definitely learned a lot about this surrogacy, and most importantly, we hope that we were able to clear up the misconceptions towards surrogacy. Surrogacy is illegal, and there are still a lot of alternatives out there. Yes. But most importantly, find out the factor of infertility, right?
That's right.
Yeah. So if you still have any questions, feel free to drop a comment or message us so that Dr. Helena will be able to answer your questions. So thank you, Dr. Helena.
Thank you very much.
Thank you for watching.
Thank you for coming. Thank you. Bye. See you. Bye.